Screening modalities not only can diagnose early cancer, but can also prevent cancer. It's one of the few cancers for which screening can actually prevent the development of cancer. Screening for colon cancer picks up small polyps in their benign phase, polyps which over the years will grow and become malignant. Unlike mammograms, which are really a life-saving screening modality, mammograms can diagnose cancer early and save lives, but they cannot prevent cancer. Colon cancer screening can prevent colon cancer. Colon cancer screening for people who are at typical risk, that is most of the population, begins at either age 45 or 50. And it should take the form of a colonoscopy and then periodic colonoscopies based on your doctor's recommendations after that. There are also some non-invasive methods of screening for colon cancer, including things like CT colonography, where a CAT scan very specialized CAT scan is done to try to look for colon cancer, and also some very sophisticated stool tests, which are also used for screening. But the mainstay of screening, and the gold standard, we would say, is colonoscopy at age 45 or 50, and then every 5 to 10 years thereafter.